COVID vaccination in the U.S. Your most common questions answered, Part 2. Question 4. What are the side effects of the COVID-19 vaccine? Common side effects include minor pain and swelling at the injection site. After each injection in your arm, you may experience some slight swelling, redness, or residual pain. This is totally normal, and these side effects should go away after a day or two. You can apply a cool washcloth to your arm to reduce swelling. Exercising and moving your arm after getting the vaccine may help as well. Call your doctor if the pain and swelling don't dissipate or gets worse after a few days. Side effects are not unique for a vaccination. You may have never noticed them when you've gotten vaccinated for other viruses in the past, but the COVID-19 vaccines are not unique in this way. There have been 7 reported instances of Bell's palsy in response to the vaccination, but this is not statistically unique given the number of participants in the vaccine trials. Outside of pain, redness, and swelling, there do not appear to be any other localized reactions to the vaccine. There is no clinical data or information regarding the co-administration of the COVID-19 vaccines alongside other vaccinations. You may also experience flu-like symptoms for a day or two. Along with the superficial side effects at the injection site, you may also experience flu-like symptoms after you get the shot. These symptoms may be unpleasant, but they should go away in a day or two. If you get the vaccine and run into these side effects, just drink plenty of water, dress lightly, and take it easy for a few days. Based on the FDA's data from the trials, common potential side effects include fatigue, headache, and muscle aches or pains. Less common side effects include fever, chills, diarrhea, and joint pain. If any flu-like symptoms don't go away after a few days, contact your primary care doctor. These symptoms do not occur because you're actually sick. It is simply a result of your immune system responding to the spike protein in the vaccine. Question 5. Can you get infected with COVID-19 after the vaccination? Yes, since it takes time for the vaccine to start working and it's only 94 to 95% effective. This means that you can still become infected with COVID-19 immediately after you've received the vaccine. The vaccines are also only 94.1% and 95% effective, so roughly 1 in 20 people will not become immune to the COVID-19 virus. This is why it's important that you continue to socially distance and wear a mask, even after you've been inoculated. Nobody knows for sure yet, but there is a possibility that you can still carry and spread the COVID-19 virus even after you've been vaccinated. In other words, even if you don't get sick yourself, you may still be able to get others sick. The Pfizer-BioNTech vaccine looks like it starts working roughly 7 days after the first dose for most people, although the Moderna vaccine may take a little longer to kick in. Question 6. Why should you get vaccinated against COVID-19? Getting vaccinated reduces the odds that you spread the virus to others. It will also decrease the risk that you get sick from COVID-19 in the future. As more and more people get vaccinated, the spread of the virus will slow down. If you want to protect yourself, protect the health of others, and get back to the way things were before the pandemic, there is no real reason you shouldn't get the vaccine if you aren't allergic to it. Even if you have a history of allergic reactions to vaccines or medication, your doctor may still recommend getting the vaccine. It really depends on your doctor's analysis of your medical history. Question 7. Are vaccines required when traveling to the U.S.? There are no vaccination requirements for visitors or travelers. This applies to tourists and citizens alike, whether you're traveling to the United States or leaving the country. Some states may still have advisories in place, but there is no vaccine requirement. Since the United States has had such a high infection rate, some countries are requiring a vaccine before citizens can come home if they're visiting the United States. You may not want to take that trip to the US if you're a foreign citizen and you're trying to put off taking the vaccine. There are a variety of vaccines you are required to take if you're emigrating to the United States, but the COVID-19 vaccine is not one of them. Question 8. Are any alternative vaccines available? There are currently only 2 vaccines that are approved for distribution. The Pfizer-BioNTech vaccine and the Moderna vaccine are the only options right now. However, more vaccines may become available in the future. A lot of pharmaceutical companies and researchers are still working on developing new vaccines in the hopes that they may be more effective or easier to use than the two that are currently available. Question 9. What are the differences between the two vaccines? The Pfizer-BioNTech vaccine is a little harder to ship and store. Pfizer's vaccine has to be kept at -80 to -60 degrees Fahrenheit, -62 to -51 degrees Celsius, while Moderna's does not. This requires a lot of dry ice, and shipping it carries a wide array of challenges. A future vaccine may be easier to store, but the fact that other researchers are working on new vaccines does not mean that the Pfizer-BioNTech vaccine isn't effective. Both vaccines work the same way. They both rely on the messenger mRNA technology, which teaches your immune system to combat COVID-19 by exposing it to a spike protein. The Moderna vaccine is 94.1% effective, while the Pfizer-BioNTech vaccine is 95% effective. Both vaccines require 2 shots. The Pfizer-BioNTech vaccine injections must be administered within 21 days. The Moderna vaccine requires 2 injections given 28 days apart. The Pfizer-BioNTech vaccine is approved for anyone 16 or older, while the Moderna vaccine is approved for anyone 18 or older.